So that would be medical honesty, where you just tell people the truth. I mean, why is this something we have to advocate for?
Well, hello, Dr. Popper. First of all, thank you so much for joining me here on Guilt-Free TV. I've been wanting to bring you here for a long time, and I'm happy it's finally happening.
Well, me too. It's fun to meet new people. Isn't technology wonderful? We
I
get to meet
love it.
people all over the world, and it can be like we're in the same room, only we're not, right? We don't
Right.
travel anymore. It's great.
It is great. So, Dr. Popper, a naturopath, an internationally recognized expert on nutrition, medicine, and health, and the executive director of Wellness Forum Health. Tell us more about yourself, and what is Wellness Forum Health for those that don't know?
Wellness Forum Health is a company that we specialize in something that nobody else does, and it's informed medical decision making. And it's a simple concept. It basically goes like this: consumers, when they buy cars and houses and blenders and washing machines and television sets, they're diligent. They check things out. I mean, I've never had somebody say, "I hate the house I live in, but the realtor said it's the one I had to buy," because they were the expert, right? We don't buy things that way. And then people go to a doctor, and the doctor says, "You need, an $80,000 surgery," and people go, "Okay." There's no sense whatsoever. So what we do is we help consumers to look at risks and benefits of anything that they've done or are thinking of doing: diet, supplements, drugs, tests, procedures, to determine if it's a good idea or not, based on their perception of risk and benefit. Now we train practitioners to engage in this type of practice too. Now, I'll tell you, one of the reasons why I love this is because when people see that a lot of the stuff they're being told to do by doctors isn't very effective, they become remarkably interested in changing their diet and lifestyle habits. And so it takes them to a place that we want them to be through logic, really. And that's wonderful.
Yeah, well, I love how passionate you are about health, and that you believe that no matter how old you are, you can have a strong, healthy life. I mean, you're one of those unique individuals that isn't interested in being politically correct, which I love. You're known for your straight talk, and I truly appreciate that when we're talking about something as serious as people's lives. Can you talk about what you like to call medical honesty?
Well, the problem with it, there's a lot of medical dishonesty, but medical honesty, and you'll find this really interesting, but I did some research on this, and the American Medical Association says that what a doctor is supposed to do is to inform the patient fully of the risks and benefits associated with what's being recommended, the alternatives, even if not offered by the doctor, and the consequences of doing nothing at all. And that would truly be medical honesty, because then the consumer could look at this and say, well, based on my value system, I think that the risk I'm going to take is worth the benefit I'm going to get. Okay. So that would be medical honesty, where you just tell people the truth. I mean, why is this something we have to advocate for? Like, telling the truth is expected in almost any other. There are criminal penalties if you don't tell the truth when you're loaning money to somebody for a mortgage, right? So how is it that we don't require it here? So medical honesty is just letting people know their options so that they can decide. It's not doing what I want to do, what I think is best. It's really doing what you think is best based on your value system.
Right.
And that's what I'm advocating for.
Yeah, well, as a certified personal fitness trainer, we get grilled on making sure that everybody understands not just the health benefits, but also the hazards of certain types of exercise that people can do. So we have to, make sure that people understand that and agree to it.
Right. It's just the opposite with medical treatment in some cases. And so a good example, really important example, is cancer treatment. I mean, I was with a cancer patient looking at studies a few weeks ago, and this is a prime example. With no treatment, she should live 25 months. With treatment, 27 and a half months. Well, the first thing she said is, I'm not looking for 27 months or 25 months. I'm looking for 40 more years. Right. And the second thing is, if you look at that extra 2.5 months versus the side effects, assuming she even lives the average, she might say, and this is not a crazy idea, if I'm really only going to live for 25 months, I think I'd like for it to be high quality time. So the point is that in the case of personal training and yoga, the benefits far outweigh the risks. But in many cases, in certain types of medical treatment, there isn't enough gain to justify the risks at all. And if patients really understood it, they wouldn't sign up for so much stuff. And that's why the medical profession is really resistant to this, because it's just plain bad for business. I mean, I hate to be, not, there's a politically incorrect statement.
Tell it like it is.
Yeah.
No,
Yeah.
seriously, I need that. Well, I wanted to put the focus primarily on women's health today because I hear that it's something that you deal quite a lot with, and there's certain issues that are crucial for women to get information about. And you have a 14-hour course just on women's health alone, correct?
Yes, exactly. And you could make it a 100-hour course. There's so much to talk about, really.
Yeah. Well, let's get into it then. A lot of women are concerned about weight loss. And which type of diet is best for weight loss? I mean, you have high fat, high carb, high protein, paleo, ketogenic, vegan, intermittent fasting. People are so confused these days. And I'm hoping, which is probably what the industry wants, is that confusion. But I'm hoping you can bring some clarity to all this.
Well, I think the first thing is we have to get away from this idea that anything that works for a period of time for weight loss is a good idea.
Right.
I just did a video clip, which will air next week, on the new study that came out, everybody's all excited about. And it compared a low-fat and a low-carb diet. They said they were the same. Well, they were both terrible diets, and they were the same. They both resulted in not much weight loss. They're both equally ineffective. But when we get into this, anything that causes weight loss is good. I made the point in this video, well, I'll tell you a couple things that cause weight loss. Being in a refugee camp, you lose weight. All right, and cocaine addiction. You ever see all cocaine addicts are skinny people. Right. And so nobody in their right mind would say, let's go live in a refugee camp or take up cocaine in order to lose weight. But when the only thing you're concerned about is weight loss and you lose track of the health benefits or detriments of what you're signing up to do, I don't like that at all. So if you take a look at what is the diet that will cause people to lose weight safely, in other words, you're not trading one problem for another. I know somebody who lost 100 pounds on a paleo diet and blew out her kidneys. She's on the transplant list.
Wow.
Being a skinny person waiting for new kidneys, that's no good, right? So the one that works best is a diet based on whole plant foods that's low in fat and high in fiber. And it's pretty easy to stick to. People think it's so hard. It's not hard. You just have to learn some new tricks and tools and shopping and all that sort of thing. But it's easy to stick with. And if you do it right, one of the things that gets around that is the detriment of all, it's a problem with so many of these weight loss plans, is the weighing, measuring, portion control, point keeping kind of thing. And people say, I can just eat anything I want. I said, well, you can eat anything you want within the realm of the foods that we eat on this diet, because it is really hard to overeat lentils and rice.
Totally.
If you've ever tried to do it, how many bowls at 14 grams of fiber per bowl of lentils and rice can you eat? It's not 7, right?
Right. Totally.
Right. So it's somewhat self-limiting, and you can just have at the food, and people like eating. I like eating. I don't like restriction, Right. So that's the best way to do it.
Yeah, I totally agree with that. I mean, I'm limited in certain ways because I don't and can't eat processed sugars and sweeteners and oils because I get all inflamed.
You're lucky guy, right? Because you don't have to debate about it.
Sometimes I don't feel so lucky because it's like I can't, grab and go sometimes and go out to restaurants freely sometimes. But I fill up. I have such a hard time gaining weight, and especially body fat, which is actually really good. So I agree with you. Can you talk about why women lose bone mineral density at a quicker rate than men? And is there something they can do to slow that down?
No, and they shouldn't, because it's a normal sign of aging. See, women have higher peak bone mineral density. And the reason is the demands of carrying a child and breastfeeding on the human skeleton are really, really high. So after menopause, not going to have any more children, you start to lose bone mineral density. Men lose it too, but they have a lower peak and they don't lose it as rapidly. And this happens to women all over the world. It has nothing to do with fracture rate. And so this silly DEXA scan that the drug companies invented tells women, I tell people, you go have a test and your insurance company gets billed $200 and they tell you that you're losing bone mineral density, which is a normal sign of aging. And I assume that most people know they're aging before they go have this stupid test, right? This is not a big revelation in the doctor's office. Oh my gosh, I'm getting older. I had no idea. Right? So most people don't learn very much with something like this.
Okay.
There's abnormal bone loss. And this is if you eat a high acid, low diet, you don't exercise, you don't get any sun, your gastrointestinal system is not functioning well. I mean, you can develop osteoporosis and have weak bones. But the reason I brought up the other issue is that I think it's important to deal with somebody who really has thinning bones at an abnormal rate because they're not healthy or they don't exercise.
Right.
That's different from somebody who's been told they have a problem who doesn't really have a problem. So we try
Right.
not to treat people who don't have problems here. We're not looking for things to do.
True. Well, it's kind of like age-related muscle loss, sarcopenia, where, people gradually lose their muscle mass as they get older. But, we can do things to slow that down, like exercise, which I'm sure is healthy for bone mass as well. So
Absolutely. In fact, I'll tell you something, the more muscular people are, the less bone mass they experience. And you rarely see fractures. I mean, you can see impact-driven fractures, but you rarely see fractures in Olympic athletes because they're so muscular.
right.
And all that activity stimulates the osteoclasts and osteoblasts that remodel your bones. So
Right.
the more physically active you are, you got to stay physically active till the last day on the planet, the better off you're going to be.
Love that. Well, a lot of women are worried about breast cancer, and rightfully so. I mean, I'm reading right now from the U.S. breast cancer statistics. About 1 in 8 U.S. women will develop invasive breast cancer over the course of her lifetime. In 2018, an estimated 266,000 new cases of invasive breast cancer are expected to be diagnosed in women in the United States, along with just under 64,000 new cases of non-invasive breast cancer. Yet you say that mammograms do not reduce the risk of dying of breast cancer. Explain that, and what does reduce the risks?
Okay, so mammograms don't reduce the risk of dying of breast cancer because they have a tendency to find these small masses like ductal carcinoma in situ, DCIS. That's not really cancer. And women don't like to hear this after they've been through treatment as if they were cancer patients, but it's
Right.
true. It's not cancer. And so that's what it finds. And then the aggressive tumors that grow in between mammograms are the ones that become problems. And so what happens when you engage in regular mammography, going every 2 years and then every year, depending upon which set of guidelines you're following, is the more mammograms you have, the more likely you are to have either a false positive, which is more mammograms than even biopsies, or be treated for something that you'd be better off not knowing about. I mean, in DCIS, 88% of the time it never progresses.
Mm.
And there's a lot you can do to make sure you don't even get DCIS. We'll get to that in a second. So the data show that for every woman who is saved by a mammogram, someplace between 3 and 10 women, depending on what study you look at, are going to be hurt by it. In other words, they're going to have surgery, they're going to have radiation, they're going to take aromatase inhibitors. Well, if you don't have cancer, that's a lot of intervention.
Right.
All right? And then I'll tell you the worst part about this that really upsets me is that these women who all would be alive 5 years later end up in the survivor category, which makes the cancer industry look like it's doing a whole lot better. And if you take a bunch of people who don't have cancer and treat them as if they do, and tell everybody they're survivors, it looks like you're succeeding. Now, if you really don't want to get breast cancer, and I don't know any woman who would want this,
Right.
You get away from the mammography after you look at the studies, not just because I said so, but you get away from the mammography, which gives people a false sense of security. Oh, I have my mammogram. They said I'm fine. I can go home and eat cheese, all right? And you really start to focus on what really reduces your risk. Eat a low-fat, whole foods, plant-based diet, high in fiber, get rid of the dairy, which contains estrogen and estrogen metabolites. And most breast cancers are estrogen receptor positive, so you don't want to be eating estrogen in your food.
Right.
And growth promoters, that sort of thing. And exercise, stay lean. Those are your best protections against breast cancer. And you can't reduce the risk entirely, but you look around the world and you don't see as much breast cancer in Okinawa, for example, as you see in North America.
Right, right. Well, I want to stay on this topic because a lot of women stay away from soy, like food, soy products for fear of phytoestrogens. Now, I know 2 women in my close circle, one that had breast cancer and one that had, what they called precancerous cells. I think you just
yes.
In the breast tissue. Now, their doctors didn't mention anything about staying away from dairy and other animal products, but they sure are afraid of soy. And when they were even told to stay away from it. What are your thoughts on soy products such as edamame, soy milk, tofu, tempeh, the more whole foods and the ones that are closer to whole foods?
Yeah, well, they're more protective than not protective. And we have a great deal of evidence. First of all, I don't believe in magical foods. So I tell people, listen, eating soy doesn't confer some special benefit on people. It's the dietary pattern that you want to pay attention to.
Mm-hmm.
Having said that, where we do really see some interesting studies is in adolescent girls. We have some really good data on adolescent girls. And in a dose-dependent manner, girls who eat soy products, whole soy products during their adolescent years have a significant reduction in the risk of breast cancer. But we really don't see studies that show that consuming soy increases the risk. So what I tell women who are asking about this, if you like soy foods, you should eat them. You could have tofu in your stir fry. You can have edamame. You can put soy milk on your cereal. If you don't like soy foods, this isn't a soy promotion diet.
Right.
You could grow old and live to be 105 and never touch soy food as long as you live.
Right.
What does aggravate me, and you mentioned this, is the fact that medical doctors will tell women don't eat soy, and they don't say anything about the extra weight that they carry, because fat cells produce hormones. They are converted to estrogen in the bloodstream. They don't say anything about the dairy products. They don't say anything about the high fat intake, nothing about the low fiber diet, nothing about exercise. They don't say anything about that. And so these women are misled. We're talking about honesty in medicine. They're misled into thinking that everything else can stay the same. I stay away from edamame and I'm going to somehow have a benefit, and that's not going to happen at all.
Right. I totally agree. I mean, I hear it all the time, and it blows me away while they're eating, pasta with cheese all over it.
Yeah.
Can women expect any changes in their menstrual cycle or symptoms of their menstrual period by going plant-based?
Absolutely. Neil Barnard at Physicians Committee for Responsible Medicine has done some wonderful studies on women and menstrual cycles and menopause and this sort of thing. When you eat a very high fiber, low fat plant-based diet like the one that you and I eat, what happens is you lose weight, first of all, and that lowers estrogen levels. You stop eating estrogen, and that lowers estrogen levels. And then the high fiber means that you eliminate and you get rid of estrogen metabolites that are going out in the feces. And when that happens, you see a lot of changes, one of which is reduction in menstrual bleeding, reduction or elimination of PMS. Infertility sometimes resolves. We've had a lot of cases of that here.
I'm sorry to interrupt. Did you just say reduction or elimination of PMS?
Yeah.
Okay. If that doesn't get you to make a change, I mean, really?
Yeah, well, and I tell women all the time, the average woman will have a few hundred menstrual periods in her lifetime. Do you think God really intended for us to be miserable 700 times? I mean, come on.
Yeah.
To be something that takes up a lot of your time. And another interesting thing that will happen is that often the menstrual cycle lengthens so that it turns into like 33 to 35 days instead of 28. So you actually have one fewer menstrual period a year. And most women like that too.
Right.
So a lot of misery goes away. And along with it, conditions like endometriosis tend to clear up and that sort of thing. So a lot of things get better.
Yeah, apparently. Can you talk about plant-based pregnancy and what expecting women need to know? Because I get questions every once in a while, because I have two plant-based children, and my wife, my whole family is plant-based, and they weren't plant-based when they were born. And my wife didn't go through a plant-based pregnancy. So my youngest son, when he was 2, and my oldest son, when he was 5, they both switched to a plant-based diet. So they had their before and after. But what do you tell women that are pregnant and expecting, and what they can anticipate, what they can do, and also during infancy?
Well, I think the first thing is that we've got to stop thinking of pregnancy as a disease. I mean, I have a good friend during her last pregnancy, they want to do all this intervention. She said, I don't know if you've noticed, but I'm pregnant, not sick. Okay. So that's the first thing. This is, our bodies are specifically designed and engineered to carry and deliver children. This is not a disease. Eat well, exercise. And you don't need to take supplements in most cases. The diet will provide everything that you need. I mean, people think you got to take folic acid. Your folate needs can be made with a dozen spears of asparagus. I mean, this is not hard to do every day, right? And if you eat right and exercise, several things will happen. One of the things is that you don't have as much weight gain. I mean, I've seen women who gain 50 pounds when they're pregnant. In Japan, they gain about 12, right? The babies don't grow so big you can't deliver them vaginally. And vaginal delivery is very important for the health of the baby, because that's how the baby acquires a microbiome. That's the biggest way in which the baby acquires a microbiome. So you don't grow a baby so big you can't deliver it. The third thing is the babies have a taste for foods. I mean, we have some good research showing that moms who eat a wide variety of foods that are plant-based during pregnancy, the babies are easy to start feeding solid foods when it's time. They're not colicky, they don't fuss, particularly moms who are vegan or eat a plant-based diet when they're breastfeeding. And the other thing is that you've never been through this, but women who have know what I'm talking about. Carrying a baby, delivering a baby, and then taking a home and caring for the baby after delivery. This is an Olympic event, all right? They require a lot of attention. And so women in good health have no trouble doing this. I mean, I'll tell you a couple of stories from our yoga studio. We have a hot yoga studio here. And in one situation, a plant-based pregnant lady came to class at 9:30 in the morning on a Friday, gave birth at 4:30 in the afternoon, 9 months pregnant in a hot yoga class for 90 minutes, gave birth at 4:30 in the afternoon, and 10 days later was back in yoga again. And expressing milk, handing the child off to dad so that she can go to yoga. I'll be home in an hour and a half.
Wow.
And so another one, we had an attorney who was coming to yoga on Saturday morning, went out to get in the car, her water broke in the driveway, she went back in and got her husband, said I was going to go to yoga, but I think we better go, baby's coming now. And then he's back 2 weeks later. And so you get these uber moms who delivery is not difficult, they vaginally deliver, they feel great, they go home in their pre-pregnancy jeans or they're in them in a couple, 3 weeks after, they're back to physical exercise. And so the demands of running around after a little baby that just very unhealthy women,
right.
These women are, they don't have these kinds of problems. So it's often the difference between motherhood being fun and exciting and all that kind of stuff versus, oh my gosh, how am I going to live through this? Because we're 5 days into this. How long does this last? 18 years,
I'm so happy you mentioned all these things because I was always wondering why there was so much suffering that's involved in childbearing.
Yeah.
I mean, so much. I mean, when my wife was in the hospital giving birth, I mean, she was suffering, but there were other people, other women in other rooms screaming for someone to save their lives. They felt like they were dying. I mean,
well, and then it gets worse later on because the babies are colicky when you formula feed them, or if the mom's eating a bad diet during breastfeeding, and just the energy. These women just don't have the energy, and so we love. Not only is it fun to be a plant-based pregnant lady, it's fun to be a plant-based mom of a newborn, and they bring them in here. If we had a mom visiting right now to pick up some stuff in our store with a newborn, you wouldn't hear crying and screaming out there. I mean, they cry when they're wet, they cry when they're hungry, but they don't cry all day long because they're uncomfortable. They've got gas and they've got rashes and all that kind of stuff that you see so often in newborns.
Yeah. So what I hear is that when a baby is born, their vitamin B12 levels are virtually zero. Is that true? I mean,
but this isn't a disease, and their vitamin K levels are low too, so they don't bleed to death during delivery.
Okay.
And so the not only do doctors want to do interventions of all types during pregnancy, and another one of our folks told a doctor one day in very stern terms, and sort of like the I'm not sick, I'm pregnant. She said, we don't need to do all this. My body was specifically designed and engineered to perform this task, and it will do so without your intervention. Thank you very much.
Right.
So, and then they start the business of your baby needs vitamin D. Really? How did humans survive so you and I could have this conversation during all those millions of years where there were no vitamin D pills? Right. If they say your breast milk won't have vitamin D. No, it won't, because vitamin D is not supposed to be consumed in breast milk or food. You go out in the sun. People say, oh, you can't take a baby out in the sun. Well, I'm not talking about putting the kid on the patio and coming inside for 4 hours. I'm talking about take the baby out in the sun as soon as you possibly can, That's what, so we do so many unhealthy things with these little people. And we treat infancy as a disease that requires intervention.
Yeah, I hear that. What is your take then on vitamin B12?
I think if you're going to eat a vegan diet with no fortified foods, you should take it. But I'll tell you something that surprises people is the B12 deficiencies are much more common in meat eaters, the carnivores, than vegans. The reason is that the carnivores end up with more gastrointestinal disorders. So B12 and autoimmune diseases both. And so B12 requires intrinsic factor, which is produced by the parietal cells in the gut. in order for the B12 to be usable, absorbable, and usable by the system. And so people who have these GI disorders, which are rampant in carnivores, as you know,
Yep.
are much more likely to have a B12 deficiency than somebody who eats like you or I do.
Okay. Good point. Okay. So what are your take homes, your bullet points for women that are wanting to go on a plant-based diet yet are fearful?
Well, first of all, what you should be fearful about is not doing it. And I'll tell you why. I'm 61 years old, right? And I'm at an age where a lot of my peers are taking medications. They're overweight or obese. They visit a lot of doctors. They've had procedures and body parts taken out, hysterectomies and
Right.
gallbladders removed, and all this sort of thing. And I really don't require it. The last time I made a claim on my health insurance was 1994. And it was because I got bit by my own cat when he got outside, and I had an infection. The cat bites are really highly
Nasty.
virulent, yeah. And I had to take an antibiotic for a week, and that's the only medical intervention I've had of any type since, whenever. So the key to freedom, at my age, I'm planning to live for another 40 years. I have a lot of work to do, maybe longer if I can. But at my age, what I think people are looking for is you don't want to end up disabled. You don't want to end up in a nursing home. You want to live until you die.
Mm-hmm.
You want to be active, mentally present, and cognitively sharp. The ticket to that, you got to take care of yourself. And I've said this to many people, women have a tendency to put everybody else first. And they often blur the line between being unselfish and selfless. Those are two different things, all right? Selflessness is when you take care of everybody but yourself for a long, long time. Mm-hmm. And in the process of doing this, you commit often the most selfish act of all, which is you get sick, and then you become the burden on all the people you were trying not to impose on at all. All the soccer games you went to instead of the gym because you couldn't be 15 minutes late and that sort of thing. It catches up with you. So the key to a healthy, long, happy, vibrant, do what you want to life is doing this. The fear is not in doing it. It's the fear is in not doing what's going to happen to you if you don't eat well and take care of yourself.
Wow, huge. Did y'all hear that? Man, this is resonating big time. Talk about your book, Food Over Medicine.
Yeah, so Food Over Medicine is done in an interview style. I had a great co-author. Glenn Mercer is a marvelous author, and it was his idea to do it interview style, and people love that because it's easy to understand and that sort of thing. It's been made into an audiobook. And then the food, I don't know if you saw Food Choices. The book for Food Choices is being sent out a chapter at a time. You can sign up if you want to get a chapter at a time, and then at the end we'll publish it. And I'm writing The Yo-Yo Effect, a new diet, a book or a movie on dieting that's coming out in June. So I'm writing a book on that one right now.
Sweet. So where's the best place for people to find you? We find your book and your services.
Go to wellnessfarmhealth.com. My email address is pampopper@msn.com. I answer all my own emails, so feel free to email me with anything, questions you have, whatever.
Yeah, you're very accessible. I'm going to have that all linked down in the description for easy access for people. Dr. Pam Popper, thank you so much for being here. You and your work are truly appreciated.
Thank you so much for having me.
Yeah, my pleasure.